together, चलो दौड़ते हैं. Fight against cancer, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं. Yeah. कैंसर खुशहाली फैलाए, एक उम्मीद फिर से हर दिल में जगाए. चलो लड़ते हैं, चलो बढ़ते हैं, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं. Fight against cancer, चलो दौड़ते हैं. Let's run, चलो दौड़ते हैं.
Detect early, treat timely, eradicate totally. A global cancer awareness drive. Grace Cancer Foundation.
You gotta hit cancer, a big blow. It's time to wipe off this foe. And show, let's get set and go.
This program starts in 2 minutes.
हम मिलके चलो लड़ते हैं, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं. Fight against cancer, let's run together, चलो दौड़ते हैं. कैंसर को रोके, खुशहाली फैलाए, एक उम्मीद फिर से हर दिल में जगाए. बढ़ते हैं, चलो बढ़ते हैं, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं. Against cancer, चलो दौड़ते हैं. Let's run together, चलो दौड़ते हैं.
Detect early, timely, eradicate totally. A global cancer awareness drive by Grace Cancer Foundation.
This program starts now. Hello everyone and welcome to the Grace Cancer Foundation 5th webinar on healthy lifestyles and cancer prevention. So today we have a panel of experts with us to talk to us. Some of them very renowned doctors and running gurus, I can say. And let me introduce one by one. We have Dr. Chinnababu with us, who's a robotic surgical oncologist and at Apollo Hospitals and also the founder of Grace Cancer Foundation. We also have with us Dr. Hemant Udayraju, who is also a robotic surgical oncologist with Apollo Hospitals and great marathoner and also a co-founder of Grace Cancer Foundation. We have Dr. Murli Nanapavineni with us, who's another marathoner and president of Hyderabad Runners. And we have, last but not the least, we have another excellent marathoner with us, who's the founder of Hyderabad Runners. And I welcome you all, Dr. Chinna, Dr. Hemant, Murli, and Rajesh Vichar. So this particular webinar is being hosted as a run-up to the Grace Cancer Run 2020, which is the 3rd edition, as you all know. And this time it is a virtual run. Okay, so I would request Dr. Chinna to take us through the presentation that he has for today about the topic that is healthy lifestyles and cancer prevention. Over to you, Dr. Chinna.
Thank you, Neera, for the kind introduction and extremely.
I am Roman, so it is my exam.
I consider it both as my privilege and joy to bring before you with respect to cancer and the lifestyle. So, Mira, can I have the presentation, please? This has been a phenomenal journey for us, especially for the last 5 weeks, in terms of how we can prevent cancer and how we can make a difference in the lives of people. So we're very grateful to the panel of experts right here, and I'll be very quick and brief, and I will take you through what exactly has lifestyle has got to cancer and how can we prevent cancer by modifying our lifestyle. So if you look at the definition of cancer today we look at the definition of cancer itself in terms of a lifestyle disease. So there is the importance for us, it is pertinent for us to focus on the lifestyle in order to prevent cancer. If you look at the data, the number of cancer cases will be doubled in the next 10 years. And what is important for us to note here is the infection related cancers have come down, but the lifestyle related cancers are increasing in number. So that means to say that we need to focus on how we can really modify our lifestyle. What is the reason for the lifestyle to modify, the lifestyle to impact such a big time on cancer risk? If you look at the causes, there has been an economic and demographic transition worldwide. There has been so much of urbanization. There is a shift from manual to sedentary work. There is an increased income, thereby food habits have changed. And also, we have also seen that the lifestyle, family structure has changed. So there is a late onset of childbirth. So similarly, there are various family structural alterations that we have seen. So in that sense, I would say that there is a significant change in our lifestyle because of which the risk of cancer is increasing. So next slide. So lifestyle risks, what are the lifestyle risks which can lead to cancer? Most of us know smoking, tobacco chewing, diet which is high in fat and low in fruits and vegetables, lack of physical activity is one of the known risk factors which can lead to cancer. So if you look at this, the environmental factors like exposure to UV rays and the other risk factor, which is the lifestyle, it is obesity. So obesity as such is a risk factor for cancer. So if you look at the causes of cancer, broadly we can say lifestyle related, environmental and family history. So you and I may not be able to modify much about the environmental risk factors or the family risk factors, but what certainly we can make changes is our lifestyle. So tobacco is known to be responsible for more than 90% of the head and neck cancers. We have enough data to substantiate that tobacco is a single leading cause, a preventable leading cause of cancer, responsible for more than 30% of all deaths. And the smokers have 20 times more risk versus non-smokers, especially for lung cancer. So this is the leading cause of preventable death that we can come across. So if you look at the other risk factors with respect to tobacco consumption in any form, may it be smoked tobacco, may it be cigarette, BD, hookah, pipe, cigar, whatever form it is, or for example, a smokeless tobacco, the chewing of tobacco in the form of pan masala, zarda, quid, gutka, snuff, whichever form, this will certainly have high risk of cancer. So I can conclude like this with respect to tobacco. It is the only legal product probably sold that is deadly, used exactly as the manufacturer intended. So that means to say that this is a preventable cause because more than 4,000 toxic chemicals, 50 of them are known to cause cancer. So the carcinogens are very much there, the toxins are very much there in the cigarette smoke. So please refrain if someone is already used to it. That's my personal advice. So the picture is worth 1,000 words, and this is what the message that is conveyed as far as the smoking is concerned. So the concept of, there's something called the field cancerization. So the cancers because of smoking can occur at various sites, right from the mouth, the oral cavity, they can go onto the throat, they can go onto the esophagus, the food pipe, then the additional sites like lung, the stomach, all those sites can also be implicated or affected because of smoking. So a smoker who has done less than 100 cigarettes for his life, in terms of oncology, we say never smokers, and those the recent smoker is the one who has smoked within the past 1 year. Current smoker is the one who is actively smoking 1 or more cigarettes per day or for few for some days. So The obesity again is another lifestyle factor, which is significantly having a risk with the cancer. There are various cancers. You can see the list there. It's quite big. It can be as starts from meningioma to thyroid to the food pipe cancer, the esophagus cancer, to the blood cancers, the kidney tumors. Most importantly, the cancer of the uterus, what we call as endometrial cancer, cancer of the ovary is related to that. In women, what is important is to know that obesity is linked to breast cancer. That is something that we need to note, because breast cancer is the most common cancer in the women globally. So other cancer like liver cancer, gallbladder cancer, stomach cancer, pancreas are also known to be associated with obesity. So there is enough proof that more the obesity, more the risk of these cancers. So I don't have to go into the details of this classification. Just for your information, I put the slide there. And diet is very important. Again, as I said before, on a high fatty diet, saturated fats has got a high risk of cancer. So you are what you eat. You are what you eat. So I would say food is medicine. So you need to be careful about what you eat. So in terms of diet, healthy diet itself can prevent about 40% of the cancers. Consumption of red and processed meat is associated with higher risk of colon cancer or the large bowel cancer. So similarly, consumption of more of cereals, more of fiber, more of fruits and vegetables is known to reduce the risk of colorectal cancers. So high intake of fats, particularly saturated fats, would be a major risk factor for other cancers like breast cancer. So similarly, majority of the studies have proven that more than 30% reduction of cancer, especially if you are consuming more of vegetables and fruits. So alcohol is again a lifestyle risk factor associated with cancer, and various cancers associated with alcohol consumption starts from mouth cancers, throat cancers, the voice box, larynx, food pipe, breast, liver, bowel. So the list goes on. So drinking less alcohol or abstaining from alcohol can prevent 7 types of cancer at least. So please make a note of this. And it is roughly about 4% of all cancers are directly related to alcohol. 30 to 40% of cancers of oral cavity can be prevented if you can stop alcohol. So what are my risks? How do you decide what is your risk of getting cancer based on your lifestyle? The risk depends upon the age, depends upon the family history, personal history, depends upon your race. But what is most important is your lifestyle issues like smoking, diet, your weight, and your physical activity or the exercise, for which we have a very good experts right here who will be talking about it. So quit smoking is the message that I want to drive home today. Those who have smoked about 1 to 20, the risk of their developing lung cancer is about 10-fold. For those who are smoking more than 20 cigarettes per day, the risk is 20-fold. But remember, the best time to quit is now. The benefits of quitting smoking will start within 1 hour. So the risk of cancer after smoking cessation, after 16 years is just 1.6-fold for those who smoke more than 1 to 20, up to 1 to 20, and it's still 4-fold for those who smoke more than 20 cigarettes per day. So that means to say that your benefit is definitely there. And if you want to quit smoking, if you want to say yes, I think this is the right time to quit. So what can I do in order to reduce my risk and in order to reduce the chance of cancer and prevent cancer? I would say fruits and vegetables, they decrease the cancer risk significantly. As I mentioned before, this is close to 30% is close to 20 to 30% because they contain a lot of antioxidants, a lot of carotenoids are available, which can reverse the chance of cancer. So I request each one of us, whoever is watching this live, to please do consider, if you're smoking, please do care about other ill effects of smoking on your body. So the take-home message of the last slide that I would say is do not smoke, and please maintain adequate body weight. Next slide. Healthy body weight, fruits and vegetables, be physically active, no alcohol, protect yourself from the sun. So these are the simple 7 cancer prevention tips. If you can follow them, certainly you would reduce the risk of cancer drastically. Last tip is to follow the screening recommendations which were discussed in the previous sessions with respect to your age. You can undergo some certain screening tests in order to diagnose the disease early. So thank you so much for your patient hearing of this talk, and I look forward to answer any questions that you may have. And thank you, Nira, over to you.
Oh, brilliant, Doc. That was a quick, power-packed presentation covering a lot of topics and how we can prevent cancer with a healthy lifestyle. We'll definitely have a lot of questions. We have the audience questions also that have started coming in. But before we move on to the next, I would definitely like to ask one question, Doc. You talked about obesity, obesity there as a reason for cancer, a major reason for cancer. So how about clarifying a bit more whether obesity as a child leads to the cancers or as grown-ups? At what stage do we need to counter them and correct them?
Thanks, Nira, for this question. Definitely, yes, obesity is a risk factor, not only for adults, but even a childhood obesity is a risk factor for many cancers. So, as we all know, obesity, especially in women, has a high risk for breast cancer and uterine cancer, and amongst other cancers that I've already shown before. So, even the childhood cancer also does have a substantial risk for adult cancers. So, in that sense, obesity at any age cannot be encouraged or cannot be taken for granted. So, we need to focus on adequate physical activity and moving away from sedentary lifestyle. Physical activity, any form, is advocated, and I'm a strong proponent of it because of this risk.
Brilliant. That's a wonderful answer, Doc. Thank you so much. I would now request Mr. Rajesh Vichar to take us through his presentation for us for this evening about healthy lifestyles, how to build healthy lifestyles.
Thank you, Niranjan. Thank you, Dr. Shinababu Hemant from Grace Cancer Foundation. We've been very happy to associate with you and the good cause you've been doing, especially in screening of cancer and also now, encouraging the idea of active lifestyle. I have with my colleague here, Dr. Murli. Good evening, Murli. Good evening, everybody. One of the biggest things which we currently realize is the challenge of building an active lifestyle. So Hpv Runners has been founded with the idea of creating active lifestyles and making running as a preferred form of fitness activity, which is one of the simplest things to do probably after jogging. So probably in the next 10 minutes, I'll just take you through a few thoughts of what we do at Hyderabad Runners and how it can be very helpful in terms of trying to create an active lifestyle, which is very important. So the popular thing which I keep telling in all the health reports is, as a country, especially in India and probably worldwide, it's not that we just suffer from heart problems or diabetes and all that. Is inactivity. Inactivity has become a way of life, of modern life, and that's been mainly on account of various developments which we have from the convenience of simple things of convenience of using your remote controls to the automobiles and everything. So while science and technology has made life easier, it has also made you inactive, which is a very, very
Looks like there's a technical glitch. Sound, Mr. Rajesh?
Yeah. Hello.
Yeah.
Yeah, I'm back. This seems to. I'm sorry for this. So why active lifestyle? It's proven by science and for the evolution of human beings that leading an active lifestyle makes things better biologically. Everything done from better sleep, better, feeling better, and these benefits accrue to you as you go on through your life. It's just not that overnight it just goes off and comes. So especially starting from young age and going through our middle ages, the importance of active lifestyle is, Dr. Shinababu has already shown us a lot of evidence on what it means to not lead an active life. So physical activity reduces the risk of a large number of diseases and conditions, including cancer and a whole lot of other things. So as a running group, why running is something which we would probably like to touch on is, as you're all aware, just after walking, the most natural thing for anybody to do, which is simple, which can be done by somebody, is the idea of running, and there's more than enough evidence to show that part of the human
Mr. Rajesh, looks like we lost you again.
are you able to see me? Sorry now.
Yeah, we can. Go ahead.
Yeah, sorry. Yeah. So running kind of, this slide just shows you about the idea of active life and how sports can be a source of national pride. Apart from creating recreational benefits and educational benefits, especially amongst the youngsters in academic performance, increased motivation, self-esteem, simply because we have a system in the schools where if you're not part of the school team or anything, you just get left out. So encouraging this kind of an activity is very helpful in the school system, and it's a very, very effective recreation option also. And when we run, we don't really bother about what's your societal background or this thing. It's a very community building event, community spirit, because it cuts across caste, creed, religion, gender, age. It's a very interesting thing. So it's important to promote for these kind of activities in a country like India, so that we have the spirit of doing something together. Other thing is, the economic profile of an area. So, as you're all aware, sports, these activities with marathons and all that, it improves the image of the place, the profile and the outreach. So that's another one, very, very important thing. It has a cascading effect. It's been known to prove in especially Western countries that children who have been active and young have taken up running, have taken to some important sports as they moved on in their career. So it's a very important activity which we can promote, just not only among schools, but the society at large. The next slide, Nita. So we have a lot of people asking us questions like, am I good to start running now? I'm 35 years old, I'm 40 years old, I have a back pain. So there are a lot of questions. It's been shown that, you can do this at any age, provided you don't have any serious medical condition. Or if you have that also, you can definitely approach the doctor and they will give you the option how to go about, which is very important. So you can start off very simple nearby, find out which is the nearest area for you to jog. It can be the local park. If you have a running group nearby, if you have a couple of friends, just start off with small distances of, trying to do for 15, 20 minutes. And the importance is to sustain this activity. Don't set big goals. The idea is to be active and take it. Take medical advice if it's necessary. Start with walking, move from walking to brisk walking, and then walk, jog, and then move on to trying to become a runner. So don't, there are many people who tell me like, I want to do this in 8 weeks, 10 weeks. So for people who have especially been leading a sedentary life or inactive life, it's highly recommended that you just build on slowly. At Hyderabad Runners, we have around close to 36 subgroups across the city. If you access our website, you will be able to kind of get all details of you will be able to get the details of the local group. So what we do at Hyderabad Runners is we built a like-minded community across all demographics. It's all free. Many people ask us, do we have to pay? There's nothing. All you have to do is land up with the intent to work out at the nearest location, and we'll be happy to welcome you. And we have, for people who want to move on, we have sessions like the Cows to 5K sessions, and if somebody wants to go on to do a 10K and everything. So we are active for close to 180 to 200 days in a year with a mix and match of running, strength training to bring some variation. So we have weekly, fortnightly, monthly.
Mr. Rajesh, we lost the connection again. Are you around?
Yeah, I'm around. I'm sorry. With that connection, I've been connecting. So can you just show the screen? Niranjan, can you hear me?
Yeah.
Your volume.
Yeah, can you hear me now?
Yeah, we can hear you now.
Yeah, sorry. So what do we do at Hyderabad Runners? Broadly, three areas of work. First is advocacy, to help people lead active lifestyles, make running as preferred form. Can you go to the previous slide, Niranjan, please? Niranjan, can you go to the previous slide? No, previous slide, please. Niranjan, previous slide. How can we help?
Yes, this slide is on.
The previous slide. How can we help? Yeah, right, thanks. So we work with a lot of government agencies and other corporates to help people lead this. As part of training, we have a Cows to 5K.
Looks like Mr. Rajesh has a bad connection. Dr. Murli, would you like to join? Would you like to take from here on, Dr. Murli?
Murli, can you just finish the
He's back on again. Let him go. Yeah. Good.
Yes, Rajesh, we
Yes.
can hear you. Please proceed.
Yeah. Thank you. Sorry for this inconvenience. Niranjan, can you just go to the next slide, please? Yeah. So training for novice and advanced marathoning, we do help with people with cross-training activities and yoga also. And to encourage people and have a fixed goal, we do have 3-4 events in a year: the club run, the marathon, the children's run. And we are continuously looking at working with various stakeholders across, including entities like Grace Cancer Foundation, to create awareness. And we are very happy to associate. So it's our goal at Hyderabad Runners that we would try and see how much we can reach out to create the awareness of on the entire active lifestyle. Next, please. Next slide. Yeah. So this is a very important thing which has come out from the Lancet and the British Medical Journal. This shows how general physical, you have broadly 4 areas of influence in this entire thing: the general physical activity, participation in sport, fast food and junk food, and social influences. One of the biggest problem we have today in the country is there's actually no incentive to be healthy or active. You don't have a system neither at school or societal impact, nor very poor public policies to encourage people to lead active life. So these are the challenges we face, which results in all this. So this particular chart is very important simply because it's about trying to bring interventions and weaning away people from fast food and junk food, how to create awareness, which in turn can help people make better social choices on what to do. And then the general physical activity. So while this slide is actually slightly complex to show, what is important is the perspective which we would need to look at is to create an active lifestyle is just not about running or thing. There's a lot of work to be done by various stakeholders from the medical community, the government, the corporates, the schools. If they don't really do something about this, as Dr. Chinnababu had mentioned, in the next 10 years, we're going to have an explosion, especially on lifestyle-linked cancer issues. So it's important that this becomes very critical to our public policy and our planning for our medical systems. Niranjan, next slide, please. Next. Niranjan.
Yeah, the next slide is on.
Yeah, the last slide, which is important. If you think being fit is tough, try illness. Then you'll realize that being fit is a lot easier and being active is a lot easier. And it just, good health cannot be quantified. The benefits of good health cannot be quantified. Unfortunately, people start realizing it only when they fall sick. So please try and lead an active lifestyle, and I'm sure it will have a better impact for you, just not only about cancer prevention, but for all other lifestyle related issues. We would like to thank you from Advocate Runners for having given this opportunity, and we look forward to continued association with Grace Cancer Foundation. I'd like to thank Dr. Murli, who's been here with us and supporting the entire. Thank you, Niranjan, for this opportunity.
That's wonderful inputs, Mr. Rajesh. We're really happy that Hyderabad Runners is supporting this great cause of cancer prevention, and you're coming forward in big way in support of the run, as well as today in order to share this information with all the audience of us. So I have one quick question to you. You've already covered how a person can start an active lifestyle, but would you be able to elaborate just a little on where a person can start, active lifestyle? How, if today somebody decides that yes, I would want to change the conditions and I would want to start an active lifestyle, can you please suggest a few steps that the
Yeah.
person can take?
Yeah. So as I was mentioning earlier, trying to be unhealthy in India is very easy simply because there's no motivation. You don't have from safe roads, parks, or good payments, none of them. So it does require some amount of motivation for an individual. So to begin with, I say that the first step is the longest mile is from the bed to the bathroom. So you need to get up that day and decide, don't postpone it. Don't make a decision that I will start it on 15th of this month, next month. The day you think about it, the very next day, please get up and you need to make your way to the nearest place, deciding that you want to walk for 15 minutes or 20 minutes. Don't set big goals. Try and see if you can work for 3 to 4 days, maximum 20 minutes, 30 minutes. There are some people who set big goals like, okay, I want to run a marathon. No, don't do that. Just start with a goal of working for 20 minutes, 30 minutes. Then that kind of gets you started and you start feeling the effect of it. Once you do that, then start planning out with your what's the challenges of your professional life and personal life, giving out that time for it and take those baby steps, and try and reach out to friends who are already active, create a community of people who are like-minded, because many people have these withdrawal symptoms that if I start waking up early, I can't sleep late, I lose my social connections and all that. But the fact that you start building a new community, you're going to get your new social connections. So don't be excessively worried that in the night I couldn't meet the set of friends whom I used to sit down and have dinner with and things like that. So there are small interventions that need to be brought about in this busy lifestyle which we lead. And then that gets over. One of the other interesting thing is keep a small diary of what you do to make yourself feel happy that this is there is improvement. So human beings want improvement, they want progress, and the best way to do that is actually keeping a log of what you do. I know there are a lot of apps, but nothing like really putting it on a book. So with these small things, you can start off and then build on that. Don't take big goals. That is a critical thing.
Wonderful. Thank you so much, Mr. Rajesh. I would now request Dr. Murli Nanapaneni to add a few words on how a diet is related to cancer and how a person can modify his diet to prevent cancer. Over to you, Doctor.
Unmute, please.
Thank you, Neera, and thanks everyone. Thanks to the Grace Cancer Foundation for actually bringing this platform so that all of us could share a few things with the rest of you that are watching today. And in fact, it's very important, and like Chinna keeps talking about it. We are in the COVID pandemic era right now, and all our attention, personal safety, whereas governmental resources, anything else is all being taken up by the coronavirus. And by getting so focused into that, whether it is your own personal preventive precautions or even in the hospital setups, spaces available, every other disorder or illness is kind of being put in the back foot. So it is aptly important to continue to focus on these critical illnesses that are quite debilitating. And in fact, if you look at the whole thing, cancer has got a far more degree of deaths per year. But it doesn't mean that we need to unfocus on the coronavirus, that's what they do, but bring about and make sure that we continue to do so. A good effort by the Grace Cancer Foundation to continue doing this. Okay. And on behalf of the Hyderabad runners and all the other fitness enthusiasts and medical personnel, thanks, Neera. Back to your question about how to bring about a good diet into a healthy lifestyle. Absolutely, what you eat, what you put into your body is absolutely as important as what you do. So while, as Rajesh had mentioned, physical fitness, healthy lifestyle choice and all that, and to supplement that, it's not just physical activity. You have to make sure to do that, you require fuel. And nutrition is something that gives you the energy to do all the physical activities that Rajesh had mentioned. And what you put in as fuel, it's like very simple. You go in, you get some adulterated fuel in your car, you will have problems with it. You buy, you fill it up with some good diesel or petrol, and you make sure you add the right oils and everything in your engine. It'll run perfectly fine. It will continue to run without any breakdowns. Likewise, if you take it, simplify it, our human body is the same thing. We basically require glucose, but in how we bring that glucose into our system is very important. So what you eat, you have, as Dr. Chinnababu had mentioned earlier, antioxidants, they help a lot of what in cancer, preventive vaccine, flavonoids and all this. So your choice of foods, we need to minimize, fatty foods. We need to bring about more healthy choices and fresh vegetables, fresh fruits, bring in fiber. If you start looking at each thing, basically going back to, particularly on the cancer aspect of this, if you start eating fiber, what Chinnababu had mentioned earlier was it'll prevent your colon cancers and other things like that. And I guess I'm sort of stepping over myself, and you'd ask me for a diet in health and in the lifestyle choice, correct? So it's absolutely critical to, I guess I'm looking at you here and talking about it, but yes, to put your answer in a brief way, eating right and what you eat is absolutely important into how you break down your foods.
Brilliant inputs, Dr. Murli. Thank you so much. We have questions, lots of questions pouring in from the viewers. And I would like to take this question from Mr. Suresh, which is to Dr. Chinna. Doctor, you had mentioned about protection from sun in order to prevent cancer. Would you be able to elaborate on that, please?
Sure, Nira. I think exposure to excessive sunlight, especially between 10 a.m. to 4 a.m., has a higher risk of skin cancers, including melanoma. So if you can avoid sunburns between 10 a.m. to 4 p.m., it is good. And if you're forced to go, you can use the protective SPF of more than 15 is good for protection. So this is a general caution, but again, this is mainly for those who are staying in Australia, New Zealand, and other countries, but not that significant in this part of the world, especially in the Indian subcontinent. But however, if you can reduce your sunburn between these hours, it's protective.
So that's a good news for many of us dark-skinned people. So we need not have to bother as much as our counterparts in the Western countries. Thanks so much, Dr. Chinna. We have one more question. This is to Dr. Hemant. What are the right vaccines for girls at young age to prevent cancer? Can you please help us out.
Hello, everyone. Um, Infections and cancer, I think, has been brought up, the topic has been discussed by Dr. Chinna. So, there is a human papilloma virus, which is known to cause cervical malignancies and gynecological, vaginal vulvar malignancies in ladies, and also penile malignancies in men, and certain other cancers. And apart from that, the hepatitis virus can, in the long run, cause cirrhosis and liver cancers. So the vaccines which are recommended basically are hepatitis vaccine, which is not age bound, but it is preferably taken along with your regular vaccination schedule. When it comes to the HPV vaccine, that is the cervical cancer vaccine, it is recommended that all girls in the age group of 9 to 16. Basically, this is a vaccine which has to be taken before the first sexual exposure of the girl, because that is when the virus there is access to the virus to the female genital tract, and the risk starts. So the ideal age is 9 to 16, extendable up to probably 24 or so, depending upon the countries. The certain countries in the West actually have, the South American, Latin American countries have actually gone on to vaccinate even boys of the age group. Currently, this human papilloma virus, the recommendation is girls, but there are certain countries which are actually vaccinating even the boys of those age groups. So basically, hepatitis vaccine and human papilloma virus vaccine, HPV vaccine.
So much, Dr. Hemant. Those are very valuable inputs for all of viewers, especially girls. This question is for Dr. Chinna from Mr. Ramesh. And, he wants to know, can cancer patients run? You're doing this wonderful run called Grace Cancer Run, and it's a mammoth event this time, which is being done in 100 different countries on the 10th of October. So, Mr. Ramesh wants to know, can cancer patients run?
Well, if I have to answer in one line, yes, the people who underwent cancer treatment, people who have recovered from the effects of chemo and radiation, who are able to have a normal diet, they can run. In fact, in the previous couple of years of editions of Grace Cancer Run, we had many cancer survivors, conquerors, I would say. They came in big numbers, and they also showed to the world that they're back to normalcy. So rebounding back to normalcy is possible, and people with cancer treatment, they have already undergone the treatment, they can safely run.
Mira, if I may add,
Yeah, please.
2018, I was doing the AHM, Airtel Hyderabad Marathon. I was doing a full marathon, and somewhere near the Trident Hotel Bend, where the crowd comes in, as you all know, there was a lady. She was like walking, running, elderly lady. So I just thought probably she needs a little help, and just tried to pick up a conversation with her. She told me that she was doing a 10K. She underwent a colon cancer surgery about a year ago. Now that lady is now a regular on the running circuits. So she's had a colon cancer surgery, and in a year she started running. So this should answer the question properly. So this is somebody whom I met on the run, mind you. I didn't know this lady before the. It's not one of my patients, operated elsewhere in some other hospital.
Wow, that's really wonderful.
Yeah, and there's another gentleman. In our first edition of Grace Cancer Run, is a 50-year-old gentleman. Once again, colon cancer, very fit. Unfortunate that he got his malignancy. It was a very early malignancy. So when we asked, like Chinna said, we had the survivors, conquerors doing the run. So we registered from our side all of these people to do a 5K, 2K for me. So this gentleman comes and says, I'm very fit, I want to do a 10K. So, sir, just go cool. And this year you do a 2K, next year we'll upgrade you to a 5 or a 10K. So the answer is, if you are reasonably fit, yes, you can take up a run, but please understand that it is a challenge, and you have to go in a graded manner in what challenge you accept. I hope I'm clear on this point.
Yep.
Absolutely, doctor. I would also request Mr. Rajesh to add on this. Have you come across any runners in the running group, like Hyderabad runners, who have overcome cancer?
So in hypertension, personally, I have not come across, but there are quite a few people who have joined after, surviving cancer. They have started off, some of them through the Grace Cancer, they've come into the 5K and 10Ks they've come. But personally, I've had a few friends and who are not here in Hyderabad, but outside Hyderabad, and some of them are overseas, who have actually taken up physical activity as one of the recovery ways of cancer. And they've been successful. They took it in a very graded way, very closely, along with the medical advice of the doctor. In fact, one was it was a cancer of the prostate area, and one was a friend of mine was suffering from prostate cancer, and there was another friend who had intestinal cancer. So both of them took it in a very graded way, trained for it, saw to it that they didn't kind of affect the recovery process. And over a year or so, they have been able.
We lost your connection. We couldn't hear you.
Sorry, I'm sorry. Yeah, over a year or so, they have been able to successfully transition to doing a 10-kilometer race, and some of them have gone on to do smaller versions of triathlons and have been successful.
Brilliant. So this question is for Dr. Heyman. I know that you are not only a good runner, but you are also into yoga. So how can yoga help prevent cancer? Any thoughts on this, Dr. Heyman?
So see, there is no direct evidence as on today to say that a certain form of physical activity actually prevents cancer, right? Be it yoga, be it running, be it any other sport or anything. Basically, there is no link between the physical activity and direct link. I mean, it's not like going A to B. Any physical activity in general optimizes your body's neurohormonal milieu. It regulates certain pro-inflammatory factors. So there is an indirect relation between any physical activity, control of weight, and that leading to chronic disorders, including cancer. So the guideline as of today is 150 minutes of moderate intensity physical activity per week. So that is 2.5 hours. So it can be something like 30 into 5 or 20 into 7. So 20 to 30 minutes of moderate intensity physical activity is going to give you long-term benefits. So it can be in terms of a brisk walk, it can be in terms of yoga, it can be in terms of any physical activity which is of moderate intensity. High intensity and low intensity physical activities may not translate. High intensity, the recommendation is to get it down to 70 to 75. It comes with certain risks of doing, it's not for everybody, but yoga is a moderate intensity physical activity. So it translates in the long run to health benefits, including cancer prevention.
That's really wonderful. We have one question coming in from Mr. Ravi, and this question I would like to give to Mr. Murli, Dr. Murli, that is. Is there any difference between a runner and a marathoner? And how does that affect their health? Dr. Murli, this
So was that for
question
me,
is-
Neera? You said something?
Yeah.
You said a difference between a runner and a marathoner.
Yeah.
Well, to make it simple, a marathoner is a runner, okay? No, all marathoners are runners, but not all runners are marathoners. Okay, so that we start with that precept. To become a marathoner, first of all, you have to be a runner. And, as Rajesh had mentioned earlier, it's about how you build yourself, how you build your body, train gradually, start step by step, take it in the right, let your body adapt to that distance, to that marathon distance. And like, as you asked earlier as well, nutrition also plays a big role. So it is how you balance a good diet, proper exercise, building yourself as you start running, take small steps, step by step, until you finally reach that marathon distance. So once you reach that marathon distance, your body is all, built in, geared, adapting, whether it is muscle fibers have changed or how your body breaks down, nutrition or extracts energy from which part, whether it is, your glucose or your stored fats and all that. So your body by then will adapt to a much complex way of extracting energy and balancing your whole oxygen and energy levels. But to start with, anybody can be a runner, and just getting out, putting a pair of shoes on, or even barefoot, and starting out and doing step-by-step small improvements would make you a runner. Okay, you can be a walker that can graduate to a runner, and if you're bored doing it alone, find an organization or a club in your neighborhood like Hyderabad Runners, and they will make you into a marathoner. You come, you will start, you get to be a runner, and slowly you'll be a marathoner. So there is no difference. They are one and the same. It is about discipline. It is about following a system, whether it is nutrition, exercise, a particular regime, and then you will get to be a marathoner. That answers your question. Is that what you asked me? But
yeah, absolutely. Thank you so much. And this question is to Mr. Rajesh, and the audience is Jyoti, who's asking this question. When one picks up a healthy lifestyle through running, chances are they can injure themselves. So, what is your take on that, Mr. Rajesh?
It's true. If you do anything without, as I mentioned again, it to be done on a graded way, and you need to be very conscious about what you're doing. And there shouldn't be any kind of adventure just suddenly that you run for a week. You have done 4 or 5 kilometers and suddenly try to move to a 10 or a 20 kilometers. You have a lot of issues like your RSA, repetitive stress injuries, come in. And then subsequently, you might get issues with knee and other problems. So what is critical is set up small goals, follow a schedule, build on it. And the idea is longevity. So what you're doing now, can you do it after 1 year, after 2 years? That's the most critical factor for anybody who's going to take up running, especially at the early stages. So don't get carried away by what others are doing, because everybody's body is different. Somebody has been running for 5-6 years. So don't try to copy them. You need to build it slow. It's better late than never, but that's very critical. So you need to listen to your body. You need to listen to your, what is the inner calling, and you need to, but stick to your goals and start working on it.
Thank you so much, Mr. Rajesh. Now we have one question from Ram, and this is to the cancer doctors, our cancer specialists. Either Dr. China or Dr. Hemant, anyone can take it. So he wants to know whether family history, if somebody has a family history of cancer, can they prevent cancer through active lifestyles?
Shall I take it, China?
Yes, please.
See, family history accounts for about 5 to 10% of cancers overall. Right? Most of the other cancers that we see are what we call as sporadic. Sporadic in the sense like there are multiple causative factors which cause cancer. Family history alone accounting for cancer accounts for a minority, 5 to 10% of cancers. And there are certain patterns like breast cancer, certain gynecological cancers. Not every cancer is inherited, runs in the family, right? And regarding these people, so normally we have risk reduction strategies for every cancer. So somebody who's got a strong family history of a particular cancer needs to enroll onto a screening program, which is a series of tests which are done at frequent intervals so that it will assess their risk of developing a malignancy or any pre-malignant changes. That is, any change which can go on to lead malignancy in future will be picked up and addressed properly. Now, regarding lifestyle, fitness, and other changes, it is a part of the entire package where you have to understand that if supposing somebody has got a family history of breast cancer and is also obese, the chances of getting the malignancy are definitely going up. So this is one factor you cannot control. Like Dr. Chinibabu said, there are modifiable risk factors and non-modifiable risk factors. So somebody who is slightly on the obese side and has got a family history of breast cancer has both, has a modifiable risk factor and a non-modifiable risk factor. So you can definitely work on your obesity. You cannot work on your genes, but you can work on your obesity and reduce the risk that way. So yes, in some way, if not a major, measurable, quantifiable way, fitness definitely has a role in helping these patients. Colon cancer is genetic, endometrial cancer is genetic, breast cancer is genetic. All of them have a link to overweight and obesity. So definitely you can help yourself by being fit and active. Chinna, you want to add something?
Yeah. Dr. Chinna, would you like to add something to this? Especially on what cancers can be prevented through active lifestyle.
Yeah, there seem to be some issue. What cancers can be prevented with active lifestyle? In fact, surprisingly, there's a lot of research going on fitness, effect of fitness, effect of exercise, effect of obesity on preventing cancer incidences. Lots of studies, actually, from 3 or 4 studies which are going on. And most of the cancers, like there's a huge list of cancers which are linked to obesity and overweight. It is colon cancers, you have gynecological cancers like ovary, endometrium, you have breast cancer, you have kidney cancer, you have prostate cancer in men. All of these are linked to basically the body weight, the body mass BMI. So all of these cancers can possibly be reduced, if not be prevented. There's a difference between risk reduction and complete prevention. So being fit, maintaining a good BMI, maintaining a good body weight, and in general, good fitness will probably help in reducing the risk of these malignancies. There is no data as on today to say that, okay, you do this much exercise, your cancer risk will go down this much, right? But then there is a definite link between, if you are obese, you know how much the risk increases. For example, 4% is the risk for malignancy of getting, for males to get malignancy who are on the obese side. In ladies, the risk goes up to almost 9.5 to 10%. So obese ladies have a slightly higher risk of getting malignancy. You can work on that and you can reduce the risk of malignancy. And for every 5 BMI points, BMI is your body weight by your height square. So a BMI of 25 onwards, more than 25 is supposed to be is obese. So for every 5 points increase in your BMI, so if your BMI goes up from 25 to 30, your risk of malignancy goes up by 12%. So by reducing your BMI to less than 25, you are getting down the risk by close to 12%. This is the only quotable figure that I found in literature, but you cannot say how much risk will reduce, but definitely there will be a benefit by maintaining a good, fit, active, healthy lifestyle.
Wow, thank you so much, Dr. Hemant. We have almost reached our time of this webinar, but then questions are still pouring in. So I would like to ask this last question to both Mr. Rajesh and Dr. Murli. Can someone start running after 40 years of age?
Absolutely. Sure, absolutely. I guess the only time you cannot start running is when you are a newborn. You can try, but it might take a year or so for that person to start. So definitely, to answer your question, 40 is definitely not a bar. And in fact, people that actually start running are usually, they fall in the 30 and above category. Call it midlife crisis or whatever you want. But traditionally, it is people in that age range that are filling, whether it is all these running clubs, events, marathons and all that. So it's hard to find somebody, below the age of 20 running, because they have, a whole bunch of other things to do, and they would do. And you will see people above 20s. Of course, I don't want to, quote that, because you do have people who are younger than that as well, who are picking up running. But generally, the trend goes on to 30s, 40s, and nowadays, even in India, probably in the West and all that, it's been going on, people in 50s, 60s, 70s. Even here, it is so visible. Why? Even in our Hyderabad runners, it's so evident. You come in and you see there that age, definitely you will see there are a lot of people above 40s running. So to answer your question, indeed you can, and it will improve their lifestyle. Rajesh can fill in, or Hemant or Chinna can fill in as well.
Yeah.
I
So
concur
Vecha,
with
please.
Dr. Murli. I concur with Dr. Murli.
Dr. Hemant, Dr. Chinna, do you have anything to add
Yeah,
to
I
this?
am a
Can
live
somebody
example. I
start?
started running at 38. I should say I should start walking or doing physical activity at 38, 39. And after 40 is when I can classify myself as a proper runner. Most people actually, like Dr. Murli said, most people pick up fitness activities in India, in the urban side, it is in 40s. Unfortunately, unlike in the West, we are not used to having a structured physical activity program right from teens and childhoods right through our academic careers, which run parallelly in those countries. In India, unfortunately, once we settle down, once our academic thing is over, once you're fixed up in your career, that's when you actually start focusing on fitness. That is a sad thing, actually. That has to change.
Yeah, very well said, Dr. Hemant. And I'm myself also an example of this. Even I started towards close to 40. I'm a runner myself, and thanks to Hyderabad runners, I've been able to get a lot of health benefits, at this age, and I've not only been able to perform well because of this in my career, but also I'm enjoying the benefits in health and everything. So we would now request Dr. Chinna to give the call about this run, inform our audience about how they can participate in this run and make this a memorable activity. Over to you, Dr. Chinna.
Thank you so much. Thank you so much, Nira, the race director, for being not only the RD but also the MC for this evening. I'm grateful to Dr. Murali Nanapaneni, President of Hyderabad Runners, and Rajesh Vecha, the founder, and great support from Race Cancer Foundation right from the inception of this concept of Race Cancer Run. So I just request each of the viewers to kindly block your day 10-10-2020. We're going to have a global cancer run, which is going to be in the category. Any category is fine. We just want you to start. That's what Rajesh Vecha has clearly mentioned in his talk. Anybody can start at any age in a graded manner. Please do participate in this virtual global cancer run on 10th of October. The run flag off starts at 6. You can do wherever you're comfortable, right at your backyard, and your terrace, and your treadmill, in your colony, wherever you can join. Same day, we're going to have more than 100 nations participating in this run, and we have 2 Guinness World Record attempts. One is for the largest number of viewers for cancer awareness from 7:45 a.m. to 8:30 a.m. on YouTube link. Please look for the link online, the Grace Cancer Foundation page. Also, you can upload your running videos in Facebook page, the event page of Global Grace Cancer Run 2020 between 9:30 a.m. to 10:30 a.m. and you can be part of history. And together, we all can make a difference. We can raise awareness. We can prevent cancer. The theme for this year is beat cancer beyond COVID. So let us not ignore cancer in the context of COVID, as Dr. Murali also has mentioned very clearly. Let us embrace physical activity. Let us be physically active. Let us beat cancer beyond COVID-19. Look forward to see you all on 10th of October. Please block your calendar, block your time. Thank you so much for watching this and for your patronage.